Welcome to the Professional Certifications channel. In this video, we'll explore the top 50 key terms that every candidate should know for the Certified Healthcare Environmental Services Professional (CHESP) exam. These terms are essential for understanding hospital cleanliness, infection prevention, waste management, safety, and leadership in healthcare environmental services. Let's begin.
Section 1. Core Environmental Services Concepts. 1. Environmental Services, EVS, department responsible for maintaining a clean, safe, and sanitary healthcare environment. 2. Infection Prevention, measures to prevent the spread of pathogens in healthcare settings. 3. Chain of Infection, sequence of events that allows infection to spread. Includes agent, reservoir, and mode of transmission. 4. Standard Precautions, universal safety measures applied to all patients to prevent infection. 5. Terminal Cleaning, deep cleaning performed after patient discharge, especially for isolation rooms. 6. Contact Time, the time a disinfectant must remain wet on a surface to effectively kill pathogens. 7. High-touch surfaces, areas frequently touched by hands such as door handles and bed rails. 8. Cross-Contamination, transfer of microorganisms from one surface or person to another. 9. Disinfection, elimination of most pathogens, excluding bacterial spores, from inanimate objects. 10. Sterilization, complete destruction of all microorganisms, including spores.
Section 2. Cleaning Agents and Equipment. 11. Detergent, cleaning agent that removes dirt and organic matter. 12. Disinfectant, chemical used to kill or inactivate microorganisms on surfaces. 13. EPA-Registered Product, disinfectant approved by the Environmental Protection Agency for healthcare use. 14. Microfiber Cloth, cleaning tool designed to trap and remove microorganisms effectively. 15. ATP Testing, adenosine triphosphate test used to verify cleanliness of surfaces. 16. Dilution Ratio, proper concentration of cleaning solution for effectiveness and safety. 17. Dwell time, time a disinfectant must stay on a surface to achieve proper kill. 18. Autoclave, machine that sterilizes instruments using steam under pressure. 19. Personal Protective Equipment, PPE, gloves, masks, gowns, and goggles used to protect staff from exposure. 20. Color coding system, use of different colored cleaning tools for specific areas to avoid cross-contamination.
Section 3. Waste and Safety Management. 21. Regulated Medical Waste, RMW, waste that poses a potential infection risk, e.g. sharps, blood-soaked materials. 22. Sharps Container, puncture-resistant container for needles and other sharp instruments. 23. Red Bag Waste, biohazardous waste requiring special handling and disposal. 24. Waste Segregation, separating waste by type to ensure proper disposal and recycling. 25. Hazard Communication, HazCom, OSHA standard ensuring workers are informed about chemical hazards. 26. Safety Data Sheet, SDS, document providing information on chemical properties and safe handling. 27. Ergonomics, designing work tasks to reduce physical strain and injury risk. 28. OSHA, Occupational Safety and Health Administration, sets standards for workplace safety. 29. Spill Response Plan, procedure for safely managing hazardous spills. 30. Emergency preparedness, planning for disasters such as fire, floods, or pandemics.
Section 4. Infection prevention and patient safety. 31. Isolation precautions, measures used for patients with contagious diseases. 32. Negative pressure room, airflow setup that prevents contaminated air from escaping. 33. Positive pressure room, protects immunocompromised patients by keeping contaminants out. 34. Hand hygiene, the single most important practice to prevent infection transmission. 35. Airborne pathogens, microorganisms transmitted through the air, such as tuberculosis. 36. Healthcare-associated infections, HAIs, infections patients acquire during care. 37. UV disinfection, use of ultraviolet light to kill microorganisms on surfaces and in the air. 38. Antimicrobial surfaces, materials designed to inhibit microbial growth. 39. Risk assessment, evaluating potential hazards that may impact patient safety. 40. Environmental rounds, regular inspections to assess cleanliness, safety, and compliance.
Section 5. Leadership, quality, and customer service. 41. Performance improvement, PI, continuous effort to enhance service quality and safety. 42. Key performance indicators, KPIs, metrics used to evaluate environmental services performance. 43. Benchmarking, comparing organizational performance to industry standards. 44. Customer satisfaction, measurement of patient and staff satisfaction with EVS services. 45. Training and competency, ensuring staff have the skills to perform their duties effectively. 46. Teamwork, collaboration between departments to achieve safety and cleanliness goals. 47. Communication skills, effective verbal and nonverbal communication with patients and staff. 48. Sustainability, implementing environmentally friendly cleaning practices and resource conservation. 49. Green cleaning, using products and processes that are safe for health and the environment. 50. Leadership in EVS, guiding teams to meet organizational goals through motivation, training, and accountability.
And that's our list of the top 50 key terms for the CHESP exam. Understanding these concepts will help you lead a clean, safe, and sustainable healthcare environment and prepare confidently for your CHESP certification. If you found this video helpful, please give it a thumbs up, share it with your colleagues, and subscribe to the Professional Certifications channel for more healthcare and IT certification tutorials. Thank you for watching, and see you in the next video.